Dr. Tony, I was reading somewhere where the average American eats at least 300 grams of carbohydrates a day. And when we're talking to people about lowering the carbohydrate intake, there are different approaches that we can take. So, do you typically ask people to gradually decrease or just to cut out to the goal of less than 100 grams or less than 50 grams a day?
Yeah, I think when you hear about what the average consumption is, it's shocking, number one, because you're like, what? We're in the low carb space. So we're like, what? Is that possible? And it really is, because if you just take even breakfast, right? I always use the example of like maybe some raisin bran, banana, and orange juice, right? Just that breakfast by itself is probably 90 to 100 carbs, right? So and it sounds healthy, right? Until you learn that raisin bran is a highly processed food. Fruit is nature's candy. That's the banana. And of course, the juice is what we give diabetics when the sugar is low. So we know juice is nothing but sugar. So I think how fast we drop that number depends on who's in front of you. I'll ask patients to assess what their daily carbohydrate intake is, right? And if their intake is aligned with the standard American diet, they may want to reduce their carbs at a slightly less aggressive level. So, technically low carb is in the 120, 130 range. And you can see why now, because so many people are so many carbs above that. So I'll have people to say, okay, let's do like less than 120, 130, which is technically low carb. And then we'll see how they do, adjust maybe for a few weeks, and then we'll start to ease down to less than maybe 50 carbs a day. And keep in mind, less than 50 carbs a day will put most people into a range where they become, possibly fat adaptive. They go into ketosis, but that's probably 60 to 70%. Some people need to go all the way down to like the 20 to 30 carbs per day to get to that level. So again, you look at the person in front of you. Another reason why it's important to not be too aggressive is because of keto flu. And although that will pass in a couple of weeks for most people, some people don't want to have those symptoms. Things like muscle cramps, headache, constipation, body aches, nausea, diarrhea, even dizziness. Why does that happen? Because you're not accustomed to breaking down fat into ketones as a source of fuel versus using dietary, carbs, grains, and things like that as a source of fuel. So your body's like, oh my God, this doesn't feel good. I'm not able to use these ketones, and you feel bad. So I tell patients, to avoid that, make sure you're hydrated. You need salt. Who knew, right? We always tell people to reduce salt. We need salt and electrolytes, magnesium, potassium. Some people buy products like keto chow. Other people just take supplements or add more salt to their food. Fat, believe it or not, which is not going to raise your blood sugar much and cause hyperinsulinemia, you have to add more fat. So eating fatty foods like a ribeye is better than eating lean. We don't do lean. Don't over exercise when you're going through this, and get rest. So the first thing is we want to think about people not going through that. And the other part is, if you go too fast and you have a history of gout or kidney stones that are made from uric acid needs to be excreted in the urine, but ketones do too. But guess what? The ketones are going to win as you're adapting, because you're not able to use the ketones at first. And until you become keto adapting, you can use ketones as fuel. You may actually put that ketone in your urine. Uric acid can't leave. Now you got a gout flare. So those people need to ease into it or take more medicine while they're transitioning. That way they won't get their gout and their kidney stone flare. And then, of course, if you're on blood pressure pills or you're diabetic, you're on diabetes medicine, this is so effective that in March 2022, when the American Heart Association put out a position statement about diets, and they said, finally, low carbs, okay, they made a special announcement in that statement saying that if you're doing very low carb, which is keto, you need to be extra careful because it works that well. Think about that. So we know this is the best diet to reverse diabetes. We know it's the best diet to eventually reverse your high blood pressure. So I think at the end of the day, ease into it if you need to. Most of my patients just go straight to 50. You listen to your body, but know that if you stay the course, you're going to heal metabolically.
This is an exciting time.
Yeah,
It
it is. Well,
is.
people didn't know. No, the
Mhm.
clinicians didn't know. The patients didn't know that they can heal. Yes, you can get off your blood pressure medicines. Yes, you can get off your, if you're type 2, your diabetes medicine. It's real. It happens every week in my clinic, and it can happen for the people who are watching this video.